What's up, folks? Welcome back to another episode of Wellbeing Wednesday with Matty Willz, brought to you by the fine folks over at MetroHealth. Of course, my name is Matty Willz, and this week we're here with my work homie, my brethren, my family, Micah Dixon, as we talk to Dr. Natalie Joseph, and Dr. Joseph, we're going to get to you in 1 second. But Micah, of course, is your first time on this show, so just tell the good people, a little bit about yourself.
Yeah, so I'm Micah Dixon. Catch me on the radio weekdays, Z1079, 10 till 3. I'm happy to be here. Maddie, thanks for having me on the show. I'm all about health, of course, and wellness. So I'm excited to hear what we're learning today about breast cancer and so much more.
Absolutely. And that is why we have the great doctor on again, Dr. Natalie Joseph. Thank you so much for taking some time out of your day to hang out with us as we talk about today's topic, which of course is the importance of annual mammograms and breast cancer awareness. But before we dive into that, we just like for you guys to, we know you did a lot of school work. You've done a lot of work grinding to get to where you are right now. So why don't you just let everyone know, about your journey and what your role is with MetroHealth right now?
Oh, first of all, thanks for having me. So I'm Dr. Natalie Joseph. I'm currently the director of the Division of Surgical Oncology, which is the director of cancer surgery at MetroHealth. And I also run our Center for Breast Health. I've been at Metro for about 16 years, but obviously that, as you said, was a bit of a journey. After university, went to medical school, then did training in general surgery, and then did a fellowship in surgical oncology before starting this job. So it was about 9 years after university to get to this point. So, and I've been, as I said, I've been here for the last 16 years and very much enjoy work being part of the MetroHealth family.
Wow.
For sure. Again, thank you for joining us. And of course, Micah, again, thank you for hanging out with us today as well. So we can kind of jump right in.
Yeah, so I'm interested in knowing, Dr. Joseph, tell me all about how does breast density play a role in breast cancer diagnosis?
Sure. So it's kind of becoming one of the kind of hot button topics these days. Dense breasts, basically, it's actually a normal variant. About 50% of women have dense breasts. And what density is, it's really a measure of how much fibrous tissue and glandular tissue you have in the breast when you compare them to fatty tissue. And the reason why that's important is that fibrous tissue tends to look more white on a mammogram. So sometimes it can be harder for radiologists to see subtle abnormalities or even small cancers in someone who has very dense breast tissue. If you have more fatty tissue that looks more dark on the mammogram, it's actually easier to see. And so breast density actually is one of the many risk factors for breast cancer. It's actually an independent risk factor for breast cancer. And again, that can be related to the fact that, number one, it's harder for people to see things on your mammogram, but also some thought is that because you have more of that fibrous tissue, you have more cells that can potentially become abnormal.
Thank you.
And doctor, we know that, breast cancer is so prevalent in American society. So what are some of the other factors that may influence breast cancer risk?
Yeah, so some of the other things, some of them are things that we can't control, like aging and being female, which are probably the two biggest risk factors. But other risk factors are related to our lifestyle. So controlling your weight, maintaining a healthy weight, having a healthy diet, so less red meats, less processed foods, more fresh fruits and vegetables, smoking, alcohol, or taking hormones. All of those things can actually contribute to your breast cancer risk. One other thing I did want to mention about as we go back to density is that there is now, actually the FDA just last month made a ruling that any woman who has dense breast tissue has to be notified that they have dense breast tissue. And it's also put on your mammogram report as well, so that your doctor or your ordering physician can see that. So it does prompt a conversation as to whether or not you may be someone that may need additional screening tools such as ultrasound or breast MRI as well to help with improving the accuracy of your screening.
Thank you for that. So I do want to ask this question right here. What age should a woman start going in for her mammograms, and why are yearly mammograms important?
Yeah, so great question. So at MetroHealth, we recommend that all women starting at the age of 40 and all average risk women start getting their mammograms starting at age 40. And the reason is that as the risk of breast cancer does go up as we age, kind of the the majority of women who develop breast cancers do so between the ages of 55 and 75, but there's certainly a population of women that are, in fact, in many cancers, we're seeing a population that's a little bit younger in terms of their onset. The reason why we do recommend that is that getting your mammogram doesn't prevent you from getting breast cancer, but what it does do is allow us to find it early. So we can find it when it's very small. We want to find it before you have symptoms or before you feel it. And that allows us to have more options for treatment. You have a much better chance that we can both treat you and cure you from your cancer if we find it earlier. In some populations, it's even more important because, for example, in the African American population, there's a much higher rate of early age or under the age of 45 developing breast cancer. And also there's a higher rate of more aggressive forms of breast cancer, like triple negative cancers, which can actually contribute to a higher death rate from breast cancer in those populations. So even more important that African American women in particular get screened early.
Wow. Thank
you know, and yeah, for sure. And then literally dozens of conversations that I've had with different doctors at Metro over the years, the cause and effect of making sure you're up to date just on checking out your stuff as it pertains to this, of course, but so many different other health related things, the preventative things that you can do just to make sure that somebody is aware, you can catch it early. It always comes up. It's like almost any topic we talk about. What treatments does MetroHealth offer to patients with breast cancer?
Yeah, so the treatment of breast cancer is really very much multidisciplinary. It's not just one thing. We work as a team. Many times that involves people like myself, so the surgeons, medical oncologists, and radiation oncologists. And it really starts from the time of diagnosis, where we, based on the type of cancer you have, the stage of your cancer, and there are so many other factors that we look at, we can really try to tailor the treatment specific to you. So treatments, as I said, surgery, for example, not every woman who has breast cancer needs to have a mastectomy. There are lots of different options for treatment. And in fact, because we tend to find cancers at an earlier stage, we have the option to do what we call breast conserving surgery, where we just remove that area where the cancer is, take a small sampling of the lymph nodes, and then that may be followed by radiation therapy. And we do that really taking into account the cosmetics of it as well, so that you can really have a nice cosmetic outcome. And even in those women who do need to have a mastectomy, there are really great options for breast reconstruction. And the more that we've, have evolved, what we find is that we're able to do, and sometimes less surgery, but with just as good, if not better, outcomes. And so that's one aspect. With regard to the medical management, there are many more targeted treatments now. And as I mentioned before, because we have a better understanding of how some of the different characteristics of your cancer, how they play into how the cancer responds, we can really target some of the treatments to specific receptors. And we're seeing wonderful outcomes for some patients, even in patients who we previously considered to have more high-risk cancers. They're responding really well to these treatments.
Wow.
We also do what's called molecular profiling of your cancer. So we take a piece of the cancer that we've biopsied and we subject that to more stringent genetic evaluation. And that can also allow us to see what the risk of your cancer is for coming back and can help us to make some decisions about whether or not somebody needs chemotherapy or not, for example. And then in the realm of radiation therapy, we're doing more targeted radiation, so there's less effects to the other normal tissues. And again, people tend to have a much nicer outcome. We don't see some of those like radiation burns that used to see many decades ago. And so I think in all aspects, I think we've just continued to improve. And one of the exciting things that's happened on the kind of surgical front is that although it's not yet FDA approved, there are some new studies showing that there's a technique called cryoablation where we might be able to go in and just freeze small tumors rather than even having to take out all of the tissue. But that's really reserved for very specific situations where there may be someone who has a very small, low-risk tumor, particularly in an older patient or someone who may not be able to undergo surgery. Mm-hmm. So really kind of increasing that kind of the number of the different options that we have for patients overall.
Wow. I do have one more question, Matty. My mother, she battled breast cancer in 2004 and she beat it. My auntie had breast cancer a few few years after that, probably '08, and she did not make it. She caught it late. My question is, what are some perhaps symptoms or signs that a woman can look out for that may, hint at her having it? Can she lean forward in the mirror and see a lump and then go get checked? Is it things like that that can help her catch it early on?
Yeah, I think that, one of the big things we tell people in general is that they really should be aware of their own bodies. So if you notice changes, like changes in your skin or discharge from the nipple, or just like you said, dimpling, or you feel a lump, sometimes people feel it, unintentionally. They might be in the shower or something like that, and they suddenly feel something, or even their partner may feel it. So if you notice something that's clearly different for you, you really should go and, talk to your doctor and try and get checked out. Again, obviously screening is clearly important. That's why we keep putting in a plug for that. We always remind women that, 1 in 8 women will develop breast cancer in their lifetime. So that's a really big reason why they should go and get screened. And the other is that I think sometimes people think that only if you have a family history am I going to get breast cancer, but 75% of women who develop breast cancer do not have a family history. So screening is really the most important thing, but clearly if you notice something different, make sure you go and get checked out with your doctor, really we encourage people to encourage their friends and their family. That's why we had that Breast Friends campaign last year that really just saying, don't be afraid. Or if you do notice something, maybe talk to a friend and maybe that friend can encourage you, because it can be scary. I think sometimes people are just anxious and they end up not going, but they really do need to go because that's the time that we need to intervene.
As a father, I have 2 daughters, I have a wife, so things like this, it's obvious why Micah is on today's call, because she can speak to this in a more personal and ask better questions than someone like me could. But, I feel like I am obligated to ask, are men in any way, shape, or form at risk of any of these things? Is there certain things that we should be doing or looking out for just, for our own personal selves when it comes to breast cancer?
So men, about 1% of people with breast cancer are male. So it doesn't happen very commonly in males. When it does, it can more commonly be associated with an abnormal gene or genetic mutation. So although, again, I think for all people, men included, you should be getting your regular health maintenance and just checking yourself in general. It's not usually something that's as common in men. But if you have a strong family history, even of women in your family who have breast cancer, or many different cancers in your family, or for sure if there's another male in the family who's ever had breast cancer, you definitely should get checked, because that can put you at increased risk. That kind of brings up the topic about risk assessment. So we do recommend that for most women, you at least start having the conversation about assessing your risk, probably when you're in your 30s, early to mid 30s, that when you start going to your primary care physician or to your gynecologist, that they really should start doing an evaluation of your risk. And that means not just only looking at the females in the family, but the males as well, because what we're trying to see is, are there trends? Are there multiple family members who have cancer, whether that's breast cancer or some other cancers like ovarian cancer, which have a very strong association with breast cancer? Or as I said, are there many different cancers in the family? Or we see in many people who had colon and melanoma and pancreas and breast, because some of those can be associated with different genetic syndromes as well. So they will look at your family history. They'll look at your personal factors, like things like whether or not you've had breast biopsies before, or if you've yourself had a history of breast cancer, that also increases your risk. And then there's some risk calculation that we'll do. And then based on that, it may determine whether or not we send you for genetic counseling and genetic testing to see if you carry an abnormal gene, or whether or not we will need to do more stringent screening, because sometimes patients who are at increased risk, not only will we do mammograms annually, we'll also do other tests like breast MRI as well. And then you may also be someone who's a candidate to take risk-reducing medications. So assessing that risk helps us to make those determinations. And for some of those patients, we'll even start screening you earlier than age 40 because of your increased risk.
Wow. Thank you for that.
Absolutely. I mean, just a plethora of really good information. So by the numbers, breast cancer is the most common cancer diagnosed among women in the United States and is the second leading cause of death from cancer among women. So one thing that I like to remind folks every time that we talk with you obviously you're well-knowledge doctors over at MetroHealth, is that if this video affects you in any way, if you know somebody who needs to watch it or needs any of this information, you're probably watching it on social media, whether it's YouTube or whatever. So feel free to share it with them, save the video, pass it along to whoever's in your circle that you think needs to hear this. And then, of course, early detection is key to fighting breast cancer. So if you're 40 or older, call 216-957-BRST, which is 2778, to schedule a mammogram. And for more information, you can always visit metrohealth.org/breast-cancer. Again, Dr. Joseph, thank you so much for taking some time out of your busy day. We know y'all busy, and we appreciate you guys taking some time out to kind of rap with us. And Micah, you as well. Thank you for hanging out with us on Wellbeing Wednesday. So I don't want to close it before anybody has any final thoughts, but so Micah, feel free if you have anything else, or even Dr. Joseph.
No, thank you for the information. I feel way more informed from what I already knew from social media and also from my mother and friends. And it's good to hear from a doctor herself giving us the information. So thank you for being here, Dr. Joseph, and Matty. Thank you for having me here as well on Wellbeing Wednesdays.
Yeah, and I just want to say thank you for being here, and please encourage everyone you know who should to get their mammograms. Thanks.
Absolutely. I'm Matty Willz. That's Micah Dixon with Dr. Natalie Joseph with another episode of Wellbeing Wednesday with Matty Willz. We'll see you guys soon.
Okay, thank you.